Governor Kate Brown sometimes points out she spent most of her political career looking out for the interests of children. Now she's not backing down and will leave in place her policy to put roughly 150,000 educators in front of older Oregonians when it comes to getting the COVID vaccine. She's sticking to her guns even as districts like Beaverton warn their middle school and high schoolers may not return to the buildings this school year.
Many of our students need the basics, a healthy breakfast and a healthy lunch, and a safe, warm place to study. And classrooms provide that. So we're doing everything we can to make this happen.
But it must be frustrating to be doing everything you can and then have districts like this say, we're not bringing the kids back.
Well, Oregon, as you know, is a local control state. We have 197 school districts, and each one of these districts is different.
And so they can ignore the governor's wishes to get kids back in classrooms if they want. But by deciding which groups are eligible for the shots, the governor does have significant power.
So some lawmakers, the legislature's now meeting, have called on you to change the priority to allow only districts that are committed to getting schools open before the end of the year to only give those teachers shots. What do you think of that plan?
Look, we've worked through a number of our educator workforce and communities around the state, and we're starting vaccines for seniors in 10 days. We're working very hard with a very limited resource.
In other words, no, she will not limit the shots to districts committed to returning before the end of the school year. Still, that decision to put teachers first infuriates many Oregonians 65 and older who point out that it flies in the face of science, the CDC's recommendations, and the actions of most other states.
We're one of few states that have put teachers in front of seniors. Do you regret that decision?
Look, we have put our most vulnerable seniors, those in nursing homes and assisted living, at the very top of the list. We have gone through and vaccinated every senior who's wanted a vaccine that lives in assisted living, that lives in congregate care and in skilled nursing.
The governor also pointed out that she locked down assisted living facilities and nursing homes early in the pandemic to protect vulnerable seniors. 80-year-olds will become eligible February 8th in Oregon, with different age groups getting the green light over a 4-week period down to the age of 65. But the group holds as many as 750,000 people. And with Oregon's current supply rate of just 50,000 first COVID doses a week, it would take until early June just to give all those seniors their shots. Finally, I asked the governor about the health authorities' decision to stop reporting the exact age of those who died from the virus and the date they contracted and the date they die from it.
First of all, that's absolutely not the case. When I learned of the Oregon Health Authority's decision, I directed them to continue to provide both the death counts and the age brackets on a daily basis. We're actually, I believe, the only state in the country that is providing this level of information. And then moving forward, they will provide the more detailed information on a weekly basis.
Governor Brown said the agency wanted to stop reporting the information because they did not have enough staff to do it.
I told them that I will make sure they have the staffing resources to make this happen. I'm committed to transparency and making sure that the public and frankly the media has this information. It's really, really important for all of us to have.
Pat Dooris, KGW News.